Hello, and welcome back to The Vitals, the Mount Sinai Health System's groundbreaking roundtable video podcast. I'm your host, Leslie Schlachter, a neurosurgery physician assistant here at the Mount Sinai Hospital. On this special edition of our show, we're going to discuss the role of insurance companies in healthcare and in hospital systems like ours. Specifically, we're going to delve into the ongoing negotiations between Mount Sinai and Anthem Blue Cross Blue Shield. To walk us through the facts on the ground, we're joined by Dr. Alan Adler, a practicing OBGYN here at the Mount Sinai Hospital, and he's also the Senior Director for Physician Contracting and Billing. Dr. Adler, thanks for being here. Let's get this started. How did we get here? I want the listeners to know, because I'm sure there's a lot of people listening that have Anthem. And for someone who practices, I see dozens of patients every week. We operate on patients with Anthem, and I'm losing my patients. I'm losing my patients and my patients.
Absolutely.
Because right now I have a patient on my schedule for the first week of April. We've tried to get a continuity of care. We can't. I have to move the surgery up. I have to move things around. This is so chaotic. How did we get here?
So in a nutshell, we tried to engage Anthem in specific. Now, we had other negotiations with all of three other majors, and we were able to come to agreements over the past 2 years. Anthem, we knew that the contract ended December 31st, so we tried to engage them June. They would not engage with us.
Meaning engage outside of just your normal monthly 1-hour meetings.
No, our contracting team tried to engage them to develop a new contract before it expires December 31st. They would not agree to meet with us. We started to meet with them in August, and we made some headway until about Thanksgiving. At Thanksgiving, they inexplicably just said, "We're not doing anything we agreed to, and we're not talking to you anymore." And they just had no negotiations through the end of the year, and the contract
So you guys
expired.
got ghosted by Anthem.
Basically.
I want to take a couple steps back, because I know there's so much I want to ask you that I probably can't. And there's probably a lot you want to say that I know you can't say. And ultimately, we want this deal to go through. Let's talk about just the basics. What are we negotiating? So there's a contract. What's a contract? We provide a service. We agree that they're going to pay us X. What else goes into the contract?
So much more than that, right? So the rates are the one thing. And, one of the things that everyone should know, I don't know who's listening to this podcast, if it's patients.
Everyone's going to be listening.
Well, that's good. So then they can know. So we are the lowest paid, excellent healthcare system in New York City.
How did we let that happen? Why did we agree to that in the first place?
So it started way back when, before any of us that are involved in the negotiations now were involved. Back 25, 30 years ago, when managed care was more in its infancy, Mount Sinai was not aggressive in terms of getting the rates for both their providers and also for the hospital. So there's two different sets of rates. There's a rate for the facility, which is the hospital, and there's a professional rate, which is the providers.
So let's use your services. You charge X to do a C-section. The hospital also provides services. They have to charge Y. So
Right.
X and Y were negotiated 25 years ago.
And changed over the years. But since we started so low, we've never caught up to the other healthcare systems, in New York City. And everyone knows that, including Anthem. We couldn't prove it for many years, but there's a new transparency laws that came about from the government in the last couple of years. So now we know we can prove exactly what we're getting versus, everyone else in New York.
So basically, we're paying $50 an hour for babysitting services when all the neighbors are only paying $20. Kinda.
Well, and what people don't understand, as patients, is they think, first of all, that everything is covered, right? So they think that you'll go to the doctor and it's covered. They forget that there's something called coinsurances and in-network deductibles.
Well, every January they forget about their deductible.
Right.
I know this.
So, patients come to us, to Mount Sinai, they're actually paying less than if if it is an in-network deductible or a coinsurance, because we have a lower contracted rate. They will pay us less. They will owe us less. And that's, Anthem knows that. And even with the increases that we've asked for, we will still be lower than most of the healthcare systems. So we're not asking for anything exorbitant. But more than that, there's also contract language that has to be put in. So currently, Anthem owes Mount Sinai hundreds of millions of dollars because of denials that were not, legal, because of takebacks that they shouldn't have taken back. In addition,
What's a take back?
So I'll give you an example. I did a delivery in 2022. Anthem waited more than 2 years to take the money back, which they're not
Why would
allowed
they
to
take
do.
it back?
There was some glitch in the billing, but they
Mhm.
they didn't have the right to take it back. So at this monthly meeting, I brought up, you did not have the right. They acknowledged that they did not have the right to take it back. And I said, okay, reprocess
So
it
did
and
you
pay
do a
me back.
take back?
Well, we were trying.
Mhm.
So first they said that it belongs to a blue card program, which is an out-of-state plan. They said they have no control of it. What they're doing in their network, Blue Cross of Illinois or Blue Cross of California, they said they have no control over what they do,
Mhm.
yet they're part of their network. Then they said they were part of the J card program and they have no control over that. Then they said, this is the best line I've heard in years. The one person in Anthem that could cut the check to us was on maternity leave. So this multi-billion-dollar company had one person that can cut a check, and
Mhm.
that was a year ago.
I mean, this just sounds like insurance companies.
It sounds
This
like
is like very in line with their personality. So I feel like we just keep opening up parentheses and we're never going to actually close one. But let's just be super clear. Let's define a couple of things. There's deductible, there's what's covered, there's coinsurance, then you can have other insurance. So, like, let's just say patient goes to hospital for a procedure. I'm not even going to call it something. It's $100,000. Everything, the doctor, the hospital, I don't know what procedure that is, but $100,000. It is January 5th. They haven't met their deductible. Their deductible is $5,000. All right. So a $100,000 bill, the patient is responsible for the $5,000 first.
correct.
So let's say their insurance, let's call it Anthem, is going to pay for 70% of what they deem to be appropriate and reasonable. So our fee schedule, which means the agreed upon amount that they said that they were going to pay, let's say that that's $50,000, which is sad, but let's just say that's the case. So they're going to pay us $50,000. Speaking from my own experience, sometimes the check will come through for $20,000. So that means either A, we then have to go after the patient for the remaining amount, coinsurance. So $75,000, no, 35, $65,000. What did I say? 25 or 35?
Well, if
Yeah.
we're only supposed to get 50 and they paid 30 or 20,
All right. So we'll even bring it down. So we're
right,
going to go after them for that remaining $15,000,
right.
whatever it was. Um, what patients don't realize is insurance coverage means that they may not pay the full bill. They're responsible for the coinsurance. But oftentimes we have to wipe that amount because the patient can't pay it. And we're double losing on what our costs are. What did I miss in that?
You didn't miss anything. I mean, hopefully we can work out an arrangement with the patient. But if the patient really has a hardship, I mean, Mount Sinai, works with patients to try to get, what they can afford. But
But the point of that is to prove, like, when patients are frustrated about their coverage, we have to keep our doors open. We have to pay for garbage to be like products coming in, garbage coming out, PAs, doctors, nurses, everything here costs money. So if we're not making money off of our services, we're not going to be able to keep doing this.
well, that's why we need to get rate increases, right? So even though, Anthem may write whatever they're writing in their, website, but basically we're
I have
asking,
it right here,
I'm
Dr.
sure you do.
Adler. So they're saying basically what was we obviously want an increase in our fee schedules across the board for all of our departments. The rates that we are asking for them to reimburse us, are they on par with the other hospitals in New York City?
So what I think is misleading is it's not the actual rate increase because we're starting out so much lower. Like if we're 35% below a certain other healthcare system,
Mhm.
even if our rate increase would be 2% more, we're still well behind them. So they're focusing on the actual rate increase. They're not focusing on the overall picture. So that's how it's misleading what they're telling the public.
So what so back to the question, what we're asking for them to reimburse us, is it the same, less, or more than other hospitals in the New York area?
It will still be less,
Still
even with the increases, right? Because you
so,
can't
like,
catch up in
what the
one.
hell? Why not? Like, what's the
Because
holdup here?
they're not going to do that, right? There's no way that they're going to agree to that, and we understand that. So that's why we're not asking for double-digit increases. We're asking for single-digit
So why
increases.
won't they give the single like, why?
That's a great question, and one that we would love to ask Anthem. So we actually they did reengage. We had talked about how they did not engage, and then in January, they came back with where they were in August, so not really anywhere even where they were in November. And then right before the hospital is now out of network as of last night, midnight.
Mm-hmm.
They did engage with us for several days. On Friday, we had the basis for an agreement, both on rates and on most of the language.
Yeah. Let's
And
get into the language.
and then they would, reneged the next day, less than 24 hours later.
So it's not just like the fee schedule. There was something here about removing contractual safeguards. So just for the viewers, this is on the Anthem website. It's basically their
Version.
press
Right.
release. I don't know. It made me very, very upset.
Right.
I'm not even involved in this process, and I'm very upset by this.
Well, everyone's really upset by it because it's if they would engage with us fairly, I mean, and do the contract language, there were two requirements that they had in terms of the contract language, which we agreed to. And what they're saying is actually not true.
So Mount Sinai saw additional charges. Sorry, Mount Sinai saw additional changes on how employer-sponsored health coverage operates, including removing contractual safeguards that help protect patients and employers from billing errors and unnecessary costs. What the heck does that mean?
I'm not really
What do you
sure.
think that means?
It's just mumbo jumbo, and we basically, you know, we need contract language to protect our patients,
So, like,
right?
what contract language are you looking to
So
change that they might
we're
be talking
looking
about?
to try to avoid these denials, right? And the takebacks that led
Mm-hmm.
to them owing us hundreds of millions of dollars. And when they do this takeback or they do a denial, who's responsible for it
The
eventually?
patient.
Right.
Or we have to write it off and we just keep losing money.
Right. So, if it's unfair and we're trying to protect our patients, and at Sinai, as you know, the patients always come first.
Right. So let's throw a couple fun things in there. So let's say, okay, so it's patients listening and they're like, what the heck? All my doctors at Mount Sinai, what can I do? Well, there's a couple things. So there's seeing your provider for like, check-ins, imaging, maybe just even just like a chat. So patients can still pay out of pocket to see the doctor they want to see. So each doctor or PA, because myself, I have my own fee schedule for services. You can contact the provider's office and say, how much would it cost for me to see my provider out of pocket? That's reasonable. So they can do that.
They absolutely can. Plus, some people are eligible for continuity of care.
Now let's talk about continuity of care. So continuity of care, basically you call your insurance company, you call Anthem, and you say, I'm a Mount Sinai patient. I'm going to be out of network. I'd like to complete a continuity of care form, which typically gives them like 3 months.
So, yes, it's 90 days for most conditions, but
Right.
there are certain conditions that extend beyond the 90 days.
Right.
Like
Which is on their
oncology.
website. Yeah.
Yeah, oncology.
Or like a previously scheduled surgery or something.
Or, cancer, pregnancy,
Right.
transplant.
Now, here's the thing. If you did your continuity of care too soon, like let's say you had a freak out in July, you might not get an extension for that continuity of care. So
Well, we weren't out of network, so it doesn't start till January 1. So the 90 days start when we were out of network.
that is not true. That is not what my patients are being told.
Then that's the problem.
That's a
right?
problem. So I currently have a patient right now who's scheduled for surgery first week of April. They requested their continuity of care form when they knew this was happening. They requested it. So their last day would be like their 30 days ends like second week of March. And so we just asked them to like at least complete it and they won't. They refuse to extend their continuity of care to cover their surgery. So now I have to move the surgery up to the first week, like
Yeah,
next
so
week.
that makes no sense, and
Yeah.
and you should escalate that we have a team that works on that. But
Mhm.
the problem is this, so other insurance companies had us meet with their medical directors for about continuity of care
Right.
months before we were out of network, just in case.
Mhm.
Anthem would not allow their medical directors to meet with us until 2 weeks after we were already out of network.
Ugh.
And, they told us things then, and, they said, this is true and this is true. And then our patients are finding when they call the frontline people at Anthem, they're being told totally different things.
Yeah.
One
I
patient,
mean, my patients are being told random things.
it's crazy. My niece has something called, has Anthem, but fully insured. So
Mhm.
fully insured, as per the medical directors, was supposed to run till March 31 as long
Right.
as she was seen somewhere in Mount Sinai ambulatory
You
setting.
have to have established care to have continuity of care.
Right. And, when she wanted to just go to primary care doc, which was totally fine. the primary care department called Anthem and they were told you're out of network and she couldn't be seen. So I had to get involved and say, yes, she could be seen because this is what
She's
we
been
told.
established, yeah.
So why is the frontline desk, telling people this? Number one, Anthem is so large and they're not communicating well, or are they doing this deliberately just to cause confusion? Your guess is as good as mine.
Right. So let's say a patient has, like right now, the continuity of care and the coverage is good until March 31st, right? So let's say I have a patient, I'll come up with an example. I actually have someone I'm thinking about. I have a patient who I have on surveillance for a brain tumor who's been having seizures. The goal is for this person to get seizure control over the next couple of months and then take the patient to surgery once their brain is calm and they've been controlled. That's now very stressful because they're going to be out of network. All right. Let's say that patient loves us so much they don't want to go somewhere else. They have a seizure at home, they're altered, they come through the ER. We can then operate on them. We can
Yes.
take care of that because it's an emergency, and then we'll get reimbursed at in-network rates.
So the rules for the ER, because there are federal and state regulations, is anything that goes through the ER is covered, as you just said.
Yeah.
So the ER visit is covered, any procedure, any diagnostic procedure, any surgery, and even the follow-up in the ambulatory setting from that ER visit is covered. What the rate exactly is not necessarily what Anthem would pay in 2025. So continuity of care, they should pay what our contracted rate was for 2025.
Mhm.
There are different rates when people come through the ER. So I don't
So how do
know.
you, like, audit that process?
You just gotta, see it in each department. So the ER department is going to do it. If you do surgery, you'll see what you get on that patient.
Mhm.
But yes, it is chaotic, and we don't want to have to do that. I mean, the goal here is to come to an agreement.
I thought we were gonna come to an agreement before this happened. I really thought this was gonna be, like, one of those, like, last night, like, end of the road decisions. It's, like, shocking it hasn't. Um, so what does the after March 31st actually mean for Anthem patients who are supposed to get their colonoscopies and their mammograms and supposed to they have appointments scheduled through the first 6 months? Like, what happens?
So they can pay out of pocket. They can use their out-of-network benefits, self-pay. If they're not eligible for continuity of care, remember there was a special continuation of coverage for certain plans, like the New York State regulated plan. So um, fully insured patients like my niece, or New York State Medicaid, Child Health Plus, Family Health Plus, the essential plans, and even the exchange plan, which we are no longer going to be part of moving forward, had a special extension, which we learned through the medical directors from Anthem. So those patients were covered from March 31. But now, if they didn't or weren't eligible, let's say, for a mammogram because they had one in May and they want to do it in May, and if we're not back in network by May, then they, you have to use their out-of-network benefits or go somewhere else.
So what do you want like, what's the bottom line you want patients to know as to, like, because they feel like this is happening to them? Like, what do you want them to know?
So I want them to know that this is not Mount Sinai, that we tried. We tried to get them to the table to negotiate fairly. And in fact, like I said, even last weekend, we were poised to have a deal before they reneged on it. And it's not about the rates because we agreed to the rates. We were even close to the rates back in around Thanksgiving. It has to do with the contract language, and we have to protect our institution. We have to protect our providers. We have to protect our patients. So that contract language is important for all of those people.
So are they just swimming in so much money that they don't need us anymore?
I think they need us, right? So we're talking about, 225,000 patients that use Mount Sinai. We're talking about 9,000 providers, right? So we are here, we provide excellent care. Our patients are really irate about this, and our physicians are irate.
What does this mean? So, like, these people live in this area. So, what does that mean for the hospitals that do take it? They're just going to get overrun, and then care is actually going to decrease because they're not going to be able to keep up.
Even more than that, right? So they are if they go to another hospital, it's going to cost somebody more money, right? So if they're fully insured, it's going to cost Anthem more money. If they're self-insured, it's going to cost all the employers, all the clients of Anthem more money, right? Because they're the
Mhm.
ones footing the bill. And if they have high deductibles or coinsurance, it's going to cost the patient more money. So not only may they have lesser care because the hospitals are overrun and can't accommodate them, but it's also going to cost more. So this is totally illogical what Anthem is doing.
What are some of the other things that were problematic? I mean, I know what they are. I live them, but like, did people have complaints about Anthem with regard to like getting things? Is it like just getting scans covered? Was it getting surgeries, procedures? Was it just like denials also?
Yeah, it's denials of care, right? And it's not getting authorizations. I'll give you an example just from my practice. We, have OB patients, all of them require a genetic carrier screen, right? You have to know that the two people are not carriers for the same disease. Anthem never covers it. They just deny it, and for no reason. This is a medically necessary test, and the lab fights it. We were furnished letters, and they still don't cover it, and the patient has to pay the
Is
lab
that covered at other hospitals?
covered at other insurance companies.
No. Does Anthem cover those services at other?
I
Yeah,
wouldn't
we
know
don't know
that.
that. Okay. So it's not just reimbursement. It's language to avoid things like takebacks, and it's actually getting authorization for things that you as provider say that you need for the health and safety of your patient.
Right, try to get an MRI. It's like
I mean, that is
pennies.
really hard. Yeah.
Right.
Um, for our listeners, when we ordered a test for someone, like let's say you come in, you're having headaches, we think something might be wrong. I want to order an MRI or a CAT scan or something. Typically, the insurance company will be like, nope, prove it. And they're hoping that I didn't really mean it. I didn't really want the test, and I'm not going to call. So we call, we try and get an authorization. We give the medical information. They still say no. Then you can request something called a peer-to-peer, which means the provider, the ordering person, which usually in my case, it's me. We schedule a time, speak to a medical director at the insurance company. There's a whole bunch of doctors that work as medical directors at insurance companies. You tell them what's going on with your patient and you advocate for them. Now, here's the sad part is like for me in neurosurgery, no one's really going to say no to my request. Like if somebody has a brain tumor, I get on the phone, I wait for like 15, 20 minutes. I get on the phone and then I have a 45-second conversation and it's approved. That whole rigmarole, all the overhead it took to get there is totally unnecessary.
Absolutely, but you at least got approved. So
Yeah.
many of our providers have to do all that
And then
and
it
still
doesn't get
get
approved.
turned down.
I get turned down like 2 or 3 times a year, but I think it's my specialty.
No, I understand that,
Yeah.
but I mean, it's just so unfortunate, and it's terrible for the providers, and it's terrible for the patients.
Yeah. And then another one is like for neurosurgery, there's every time when you schedule someone for surgery, there's codes that go into the surgery. So for us, there's approaching a tumor, resecting a tumor, using the microscope, using navigation, maybe doing a fat graft or something. All of those are codes. All of those have um, a reimbursement rate on the fee schedule. So you call the insurance ahead of time. You say, hey, Joe Smith has a brain tumor. We're going to use these codes for surgery. And the insurance company will say, yes, no, no. And then you're supposed to say, what? Like, I'm sorry, we're supposed to do brain surgery at a third of the price because you won't approve the code that we need to actually, no.
It's mind-boggling, and it really is, and some insurance companies are worse than others to deal with.
Yeah. Wasn't there a story about someone, like a surgeon who actually got a call during surgery that something wasn't approved?
Yeah, in the middle of a brain surgery, I had heard that, they called up and said they're only approving one side of the brain. I mean, how can you do that in the middle of surgery? It's just crazy.
That is insane. Um, so how do we recover from this? Like, what do you, from your personal experience, what do you think is going to happen?
I don't know, right? I mean, we have been there ready to engage, and we thought we had a deal or close to a deal several times only to have it pulled back. So, we don't know what Anthem's motivation is here. Now the hospital is out of network as well, all the
Mhm.
facilities, all the Article 28 sites. I mean, patients are very, very upset. The doctors are very upset.
Yeah.
Um, you know, we hope that they will come to the table to negotiate a fair deal. That's all we're asking for. We're asking for things that they already agreed to before they reneged.
So even if a patient wanted to pay self-pay to like see their provider. So let's say, all right, you're going to keep seeing me as your provider. I can send you to LabCorp for your labs. I can send you to X radiology facility to get your scans. You'll then bring that to me. We'll see you, and you can pay out of pocket for that. But if I need to do a procedure on that patient or schedule something in the hospital, that's not really an option for most people to self-pay a couple $100,000.
Absolutely not. And that's why, again, this is so unfortunate, and I feel the worst for our patients, but I also feel the worst, feel terrible for our providers. I mean, I've had patients that I've been caring for 30 years that have Anthem, and now they have to decide whether they're going to see me even
Yeah.
for their annual. And that's nothing like having brain surgery.
I would definitely pay out of pocket to see you for my annual. So, just to kind of go further into this, like, how does that conversation, is there a mediator? Do you guys pay like a third party mediator to talk to you guys? Or do you guys just like both parties come together and try and talk? How does it work?
So we have a contracting team.
Okay.
Anthem has their contracting team.
What is the contracting team like a mediator?
No,
Or like,
it's just people that work for Mount
oh,
Sinai
okay.
and people that work for Anthem. There's legal involved, and then there's the math people, right? The accountants, and figuring out what these deals are worth, and people to put together the language that we need to make this doable.
So there's probably people on both sides that have their numbers, and it's just probably coming down to numbers. It's a numbers game, like
So,
everything.
so again, I don't think the rates are really the issue. I mean, they may say that we're asking for astronomical things, and that's clearly not true. They know
Mm.
it's not true. But, they've agreed to much of the language, and then the next day, like I said, they just walk it back. So,
Would a mediator be helpful? Do people do that and stuff like this?
I haven't seen that happen in with the negotiations. I mean, is arbitration for things that, let's say, the insurance company owes you lots of money. You go to an
Mhm.
arbitrator, but that takes a long, long time.
Is Mount Sinai for profit or not for profit?
Not for profit.
Okay. So, like, how does that concept of what does that mean? Profit, not for profit, and how does it relate to the insurance and how it relates to patients?
So look at it this way, right? So we're a not-profit organization, and any money that we make gets funneled back into the system, and for things that we have to provide better care, right? So just look at the nursing strike that just happened, and the
Mhm.
nurses got an increase. We have to cover that. We have to cover increases if you're bringing a specialist on, that you want to start a new department or something, new technology, innovation. All of these things require money, aside from the money to just keep the lights on. So all that money is funneled back into the system. So think about it this way, though. We're a nonprofit organization, and Anthem, which is a multi-billion-dollar company, right? Many, many billions of dollars, owes us hundreds of millions of dollars. And this is an interest-free loan, basically, that they just have, and no interest in paying it back.
I mean,
They're
what's the
lit-
likelihood you're actually going to see that money?
So we will take them to arbitration,
Okay.
and we are working on getting,
Did
that
you hear
money
that?
back.
We're going to take you to arbitration. I'm talking Anthem.
Hmm.
So here we are, a health system caring for patients, doing research to care for future patients, reinvesting our money for innovation, research, clinical care. Just the circle of money keeps cycling around for the patient, for the patient, for the patient. And Anthem is essentially stealing money from us. And how much does their leadership make per year?
No idea, but millions of dollars. And I'm not even begrudging them that, but their company makes billions of dollars in profit. And they were arguing with us over less than $20 million.
So you were saying that like they make a lot. Um
The
and you don't begrudge them.
I don't begrudge them that. I don't begrudge our leadership for making what they make. There's a lot involved. Anthem makes billions of dollars in profit, and we just want them to consider the patients, right? So if I could say one thing, you know, um, to the Anthem leadership, to Elevance, which is the mother company, come to the table, right? It's reasonable, put your representatives, have them negotiate in good faith.
Mhm.
Um, do it for the patients, right? There are 225,000 patients that really want this to happen. There are 9,000 providers. And if you don't want to do it for the patient, then do it for your clients, right? Those are the employees that are, 80% of your business is self-insured. they're bearing the brunt of this. If they're going to different hospital systems, it's costing them more money. So now is the time. Please come to the table. If we work around the clock, we can get this done in a matter of a week, if not even less.
Right.
And we were close to a deal before they reneged. So if these are not the proper people that need to negotiate on your behalf, then get the proper people there. Our team is ready, willing, and able.
I can imagine that they're ultimately going to lose money on this deal because they're pissing off a lot of patients and organizations. And then ultimately they're going to switch insurance companies.
So, I
Not
mean,
going to work out
that's
well.
what patients can do, right? So if patients are unhappy with what's happening, they should call Anthem and complain. They should get their HR department and their benefits people involved. They should call Anthem and complain. And, if they want to, they obviously can switch insurance companies. And if they're really having trouble even with continuity of care, if it's an employer-based deal, they can call the Department of Financial Services and file a complaint against Anthem. If it's a government plan, they can call the Department of Health. And I don't think Anthem wants to get on the bad side of either one of those organizations.
Mm-hmm. Yeah, one of the things that patients should know is I know how frustrating it is to deal with insurance companies. I know how frustrating it can be even to make a doctor's appointment. Everything related to your health is really stressful, especially if you're scared. If you have a diagnosis of something, you're scared, you're not sure what's going to happen with your medications and all of your appointments. Just like take a deep breath, make the phone call, ask to speak to HR, complain, ask for what you can do. If you don't get the answer you want, call back the next day. Like you just have to take a deep breath, maybe have a glass of wine and just get through the moment because it's going to take thousands of people to do that to actually move the needle in this situation.
100%. And it's, one patient calling, it may not do it, but thousands of patients calling, and especially the HR benefits people calling, that
Yeah.
will get the attention of Anthem and hopefully get them back to the table. We just want a fair deal.
Yeah.
We were there. So it's kind of mind-boggling that
Yeah.
we're still at this point.
Yeah. My heart is, I have so many patients. Not only am I frustrated by the amount of work I have to do to deal with this right now. So I give my cell phone out to a lot of patients. So my cell phone, my chart messages, emails. At this point, I have an email signature about this. It's a lot of time and energy, and I'm just one provider that's going into explaining what people need to do. And then they get a different answer from Anthem, and I have to re-explain, and I don't even have all the answers half the time. And we're losing patients, and it's sad. I don't want to lose my patients. I don't want to have to worry about like the people I have scheduled for April that they've been waiting this whole time to have surgery, and they have to go start with someone new again. That's awful.
No, it's incomprehensible, honestly, that they're doing this.
Yeah.
And it's beyond sad. And that's who bears the brunt of it. It's the patients mostly. But, our providers want to see these patients. I mean, some of our providers, if they could, they would see them for nothing, right?
Yeah.
I mean, that's how dedicated our providers are.
Yeah. I did yesterday. Yeah. Anything else that you want to add that we did not speak on? Did I miss anything super important?
No, I think we covered it all. And, I think my message to the Anthem and Elevance leadership is clear. We are here. Our team is ready. We'll work around the clock to get this done. Just come to the table and negotiate in good faith.
Okay. And then we're going to add in you're open to arbitration if that's what you need for a mediator to help you get there.
If we can have one, that would be great.
Okay. Thank you so much.
My pleasure.
That's all for this episode of The Vitals, and that was a lot. I'm your host, Leslie Schlachter. Subscribe to The Vitals and the Mount Sinai Health System's other video podcast programming on YouTube, Apple Podcasts, Spotify, or wherever you get your podcasts. To get in touch with the show or to suggest an idea for a future show or episode, you can email us at podcast@mountsinai.org.